What do you think? What are the changes in the diagnostic approach you've taken over your career? How have things changed? Uh, and how confident do you feel on making the diagnosis?
Well, I have come to rely on your imaging approach, Scott, so much that I am very reluctant. It's happened a few times because of certain details, but I am very reluctant to go forward with an operation without the confidence that I get from seeing the results of your scans. Namely, to see that when the patients are in the scanner with their arms elevated, hyperabduction, there is bone on bone proximity, and in some cases, severe proximity, closeness, that the two bones are acting like a vice. And there's evidence that is not somebody's interpretation, but just it's there of effacement, which, as you know, is a generic term that indicates any kind of physical pressure on any nerve in the body. It's real, and radiologists are trained to see it, but they're not trained to see effacement of these nerves, nor do they understand, a lot of them, that in order to elicit this problem and to, in effect, prove that it's there, one needs to move the arms while the image is being done. And I needn't tell you that everybody in their arms with their arms down who hasn't had a birth injury is going to have normal plexus looking images. But
Totally.
it's only when you well, as you know, we'd like to be in this position, arms up, stick them up position, because
Yep.
it's the most provocative, but we can't fit in the scanner in that position. So at
Right.
least the compromise of hyperabduction moves the clavicles back a bit. I think it underestimates what's really going on in the real world with that patient, but at least it's
I agree.
showing that even in a compromised, provocative position with the arms up, there is evidence when people have this condition, and you can show this very well, evidence of effacement. When the arms are in that position, the bones are getting close enough together that they're squishing the nerve roots. That's the thing I really care about in terms of having no anxiety about bringing a patient to the operating room who doesn't have the condition. And I and as I said, I have only on a handful of occasions and now over 200 patients total of
Mhm.
having doing an operation without your imaging study. I now feel that that is a sine qua non for a successful outcome.